Okay, so here we have Susan finishing up her burst training from this morning. The reason we do burst training is we're trying to get a lactic acid response. She's going to go as hard as she can, as long as she can, for 10 to 12 seconds. Okay, it's an all-out burst. It's not a sprint, it's 100% effort. The reason we do this, we know that we can recreate a fight or flight response in her. With the fight or flight response, we're going to get an increase of her adrenal hormones, her epinephrine, norepinephrine, okay? And at the end of that time period, she's going to have a parasympathetic response. The sympathetic response would be the increase in the adrenal hormones. Parasympathetic response is a result of increased lactic acid levels, which trigger that parasympathetic response, the release of your growth hormone, testosterone, and other tissue repairing hormones, or your what we call your anabolic hormones. So I'm going to give her a countdown. I'm going to tell her to go. I'm going to encourage her to go as hard and as fast as she can for 10 to 12 seconds, and then she'll cool down for 3 to 4 minutes and repeat that process for 3 cycles. Susan, are you ready to begin?
I'm ready.
Okay, we're going to go in 5, 4, 3, 2, 1, go! Hard, fast, hard as you can. Go, go, go! There you go. Keep going. Doing great. 7 seconds. 6, 5, 4, good. 3, 2, 1, and relax. Now you notice at the end, as she got to 9, 10, 11, 12 seconds, she actually started slowing down. That's why we do bursts for 10 to 12 seconds. People say, why don't you go for 30 seconds? The truth of the matter is, you can't hold an all-out response for that long period of time. Think in terms of this. If Usain Bolt holds the world's record for the 100-meter dash, and he does it in under 10 seconds, why can't he do 200 meters in under 20 seconds? The truth of the matter is, you can't maintain a full maximum contraction for more than 6 to 7 seconds. So we go somewhere in the 10 to 12 second range because that's what we feel works. So what's happening now is she just had a rise in her adrenal hormones. Now we're coming down off of that. We start with a sympathetic nervous system response. Now we're getting into a parasympathetic nervous system response. The lactic acid went up, which causes the release of the anabolic hormones. So now we're getting that significant surge in things like testosterone, which women produce in their adrenal glands. The human growth hormone and other tissue healing compounds. The other thing we get, and studies have shown, is we get a significant reduction in CRP levels. CRP is not just an indicator of inflammation in the body, but it's also a cause of inflammation in the body. CRP increases interleukins and cytokines, which cause inflammation. Predominantly inflammation of the arterial linings. Okay, so it increases your risk for heart disease and stroke and heart attack. So that's a little bit about burst training, and have a great day.